Hi, my name is Jonathan Harrison. I'm a freshman at Ohio Northern University. And my project was the use of post-fall huddle form to determine fall risk factors. Background. Falls have been known to be a recurrent problem within hospital settings. The Lutheran Hospital Fall Committee began a pilot project using a post-fall huddle form with the intention to identify the risk factors. The purpose of this pilot study was to determine what constitutes a risk factor for a patient with severe and persistent mental illness. We hypothesized that the risk factors for behavioral health units may be different than a medical surgical unit. For this pilot study, we used a retrospective fall log as reported in the Safety Event Reporting System, or commonly known as SERS. The data was obtained from the Falls Committee at Lutheran Hospital. The data we collected included age, gender, date and time of fall, diagnosis, history of falls, where the fall occurred, patient's Morris fall score at the time of the fall, new illness, electroconvulsive therapy, also known as ECT, whether the fall was witnessed, if fall precautions were in place, and the total number of medication doses. In our results, we found that 46% of the falls at Lutheran Hospital were in the geropsych units, and 42% of the falls were in the adult psych units. For our age, we found that the majority of our patients that fell were in the range of 80 to 90. Items in reach, we found that the majority of items were in reach most of the time besides the phone, food tray, assisted device, and urinal. Trip hazards. The clothing trip hazard obviously is definitely a big deal in a behavioral health unit because the patients aren't allowed to have belts, they're not allowed to have anything that can hold their pants up because of the fact that it is a behavioral health unit and they don't want that to be used as a weapon. Number of medications given, we found that the majority of medications given were anti-anxiety medications. The average doses given, the most were opiates. Conclusions. We found that 85% of the falls were located with behavioral health at Lutheran Hospital, and that clothing represents a significant trend with environmental factors. There seems to be an association between falls and needed items being out of reach, and we also found that individual patients are receiving a high amount of opiates, anticonvulsants, antipsychotics, and anxiolytics. It appears that the cumulative effect of multiple high-risk medications given to a patient may have significant effects on patient falls. We recommend that a controlled study be done in the future. The study should control for diagnosis, age, gender, Morris fall score on admission, unit the patient was placed on, and the date of the fall. Acknowledgements. I would like to thank the following people and organizations: my mentor, Loran Murphy and Mary Matzinger, Lutheran Hospital, Nedra Starling, Rosalind Strickland, and the team in the Office of Civic Education Initiatives.